welcome to the Master of Public Health Online's Programs Student Success Story Spotlight on Michael Pham webinar, presented by the Keck School of Medicine at University of Southern California. I am Enrollment Advisor Phil Solaria, and I'll be your host today. First, I'd like to thank you for taking time out of your busy schedule to join us. Before we begin, I'd like to review what you can expect during the presentation. Here is a quick look at what we will be covering. With us today is Dr. Shubha Kumar, Program Director of the Master of Public Health Online Program at USC. Spring 2016 USC Master of Public Health Online candidate, Michael Pham. And Stephen Gutierrez, Enrollment Advisor for USC's Master of Public Health Online program, like myself. First, we will hear from Dr. Shubha Kumar, who will share a little bit about her background with us. Then, Michael Pham will tell us a little bit about himself and share his experience leading public health efforts in the Dominican Republic this past summer and as a current student in USC's MPH online program. Lastly, I will speak to the admissions requirements, important dates and deadlines, and information about how to contact an enrollment advisor to begin an online application. We will end the presentation with a brief Q&A session. Now let's get started. Hello, Dr. Kumar. Thank you for joining us today. Please share a little bit about yourself with our audience.
Hi, Phil. Thanks for turning it over, and thank you, everyone, for joining us. Apologies again for the delay. So, a little bit about my background. I have worked in health for years now. My interests are specifically working in low and middle income countries to improve management and health promotion. I came to academia as a result of working with several NGOs across the globe, seeing how they operate and how we could operate more effectively. And I'm very passionate about public health, just like our student, Michael Pham, who you're going to be hearing from very soon.
Thank you. Hello, Michael Pham. Thank you for joining us. Will you please share a little bit about yourself with our audience today?
Sure. Hi, everyone. My name is Michael. I'm a second-year student here in the MPH program online. And it wasn't so long ago that I was listening in on the seminar, too, as a prospective student, and I'm really glad to be here right now as someone who's almost graduating. I did my undergrad at UCLA, and I trained there also as an EMT and as a paramedic. And I spent a lot of the past 6 years working in emergency medicine, working as an educator, as a paramedic, and working in the field. I, during this time, got the chance to start an organization called the CPR Training Center, which is one of the largest American Heart Association training sites in Southern California. I believe we certify about 10,000 people a year, and that's just only within the U.S. And here we are doing also efforts internationally. And I've gotten a wonderful opportunity to combine this type of work that I've been doing.
Let's see. Yeah,
Hello?
I was going to say.
Hi, Phil, do you hear me?
Yeah, I can hear you, Michael. If you're not a panelist, please mute your phone. Thank you.
So continuing, I've gotten a wonderful chance to utilize my MPH curriculum within my work and also do directed research with wonderful faculty members. And I'm happy to share my experience later about the work we did internationally.
Thank you, Michael. Before Michael shares his experience leading public health efforts in the Dominican Republic this past summer, Dr. Kumar, can you provide some context for our audience? Why was Michael selected to be our featured student success story today?
Sure. Actually, this whole webinar series has been inspired by Michael, to be honest. Michael was taking my class in the summer on directed research and sharing with me a little bit about what he's doing at work and this exciting project he was doing in the Dominican Republic to train folks in emergency response. And in the course, we started talking about how he could combine his assignments to complement what he's doing in his job. He came back from Dominican Republic after his project ended and had a lot to share. It was very exciting work and really kind of inspired us to create this series.
Thank you, Dr. Kumar. And with that, let's turn it over to Michael Pham. Michael, please tell us more about your public health efforts in the Dominican Republic.
Thank you, Phil. Thank you, Dr. Kumar. So, again, everyone, the work that I did in the summer was the past summer, and I had the chance to also work with Dr. Kumar during one of the courses offered, which is directed research, and that's one of the great things about the MPH program, and is being able to do directed research with a faculty member. And so we did our work in the Dominican Republic, and I'll go to the next slide there. So I think everyone can kind of read here. I'll kind of summarize basically the problem, but the reason why we went into the Dominican Republic was because, well, in any type of, I believe, public health or any type of health-related issue, there's always some type of need. And for the Dominican Republic, it is one of those countries that is represented as a low-income developing country, and they do not have a unifying emergency medical services system. And so I think for us, and for those of you that work or live in Los Angeles County, for myself, I spent a lot of my past years in LA working and being a student. And even in LA City, it's so crowded, but you know what? The response time for an ambulance is less than 6 minutes from the LA City or LA County fire departments, and that's very impressive. However, in other countries, you're talking about a delay in response time upwards to 10, 15 minutes greater, and even if they get on scene, who knows if they're actually doing the right type of assessment or protocol as well. So in the Dominican Republic is one of the leading countries in Latin America that actually has the highest number of deaths related to trauma and pre-hospital trauma out of all Latin American countries. And so it's a staggering number, and almost as much as 11 people die per day due to traffic-related injuries or pre-hospital trauma. It could be auto versus head, auto versus auto, a lot of issues. And so I had the wonderful chance to work with the U.S. Embassy and the Ministry of Health in the Dominican Republic to create a system and to help implement a program based off of U.S. guidelines and standards to train their first responders, which include not only, the pre-hospital EMS personnel, but also physicians, nurses, anyone that has patient care. They have to be trained in a universal type of EMS education system so that they can communicate with each other. And again, the problem with the Dominican Republic was that we have a leading cause of death, that being pre-hospital mortality, and that there needs to be some type of program implemented to help fix this and reduce pre-hospital mortality. Next slide, please. And so I won't get into too many details about the history of Dominican EMS, but like with many developing countries, they are in no way or shape as developed as the systems we have here in the Western world. And so for the Dominican Republic, they didn't really get any type of EMS system until maybe the 1930s when there was a huge disaster and hurricane. And then Red Cross was the first nonprofit organization to come in and actually start some type of service, that being an ambulance. But then again, those ambulances were just really, as I can call them, just transportation vehicles. And, they're just kind of loading people in and they're just shipping them to the hospital. But there is no standard of care in how that person is transported, how they're treated on scene. Really, it's just kind of load and go. And so if I got hit by a car and I need spinal mobilization, there's really no standard for that. They probably just toss me in the car and I probably have to go through a couple of other injuries while en route. And so it wasn't until recently that in the 90s, the early 2000s, some type of system was being implemented. That was first being a universal 911 number. And so that is one of the problems right now in the Dominican Republic is that, people do not have a universal number to call. Before, they were calling 5 different numbers, one number for police, one number for fire, one number for medical, one number for traffic, and the list goes on. And so people are confused or miseducated, and when they're calling the wrong numbers, it's being put on hold, and they're not getting the right type of resources. So therefore, you're basically increasing response times, and this definitely affects patient outcome. And so it wasn't until recently in 2012 that the Dominican Republic formed the Ministry of Health and the Institute of 911 National Dispatch Center. And that is only in the capital of Santo Domingo, which is where we were dispatched to. But now they're starting something in the past 3 years, and now we were the next step, which is to implement a universal training program. And hopefully the work that we did is able to be replicated and extrapolated to other neighboring cities and hopefully around the country. Yes, next slide, please. All right, so as I mentioned before, the problem with the Dominican Republic is that there's no EMS authority. So in the U.S. here, we have the U.S. National Association of EMTs. We have governing bodies of emergency medicine. We have the Academy of Emergency Physicians. We have all of these standards based off of different scientific guidelines, curriculums, American Heart Association, National Trauma, Life Support, a lot of different entities that work together. But in these countries, they don't have any type of organization like this. So basically the problem is that, one, there isn't a universal system, so people can't really agree on how folks should be trained or transported. Two, there isn't cooperation or coordination amongst other healthcare professionals. So let's just say that if I picked up a patient in the back of my ambulance and I bring them to the hospital, they don't really know what I've done. And even if I communicate to them, they're not trained to really listen to what I've done. And maybe the type of assessment I'm doing is not a type of assessment that they're doing, so they have to redo the assessment. And that just, again, delays treatment time. So for myself, when I worked as a paramedic in Los Angeles County, Station 57, if I'm transporting an ALS patient to a trauma center, such as USC or such as UCLA, I'm going to call in and talk to the registered nurse, to the mobile intensive care nurse. I'm going to say, hey, this is Michael. I'm Rescue 86. I have an 82-year-old patient complaining of chest pain. Here are the signs and symptoms. Here are the vital signs. Here are my medications I've administered, so-and-so. And then they would basically say, all right, Rescue 86. Right when I get off to that ground, I transport that patient, and they get immediate care. Now, in the Dominican Republic, they don't have that cooperation. They don't have that coordination. There's miscommunication, and people redo assessments, and basically, again, it just leads to a lack of accountability and an increase in response time and treatment time. Next slide, please. So for myself, I figure that, in the Dominican Republic, what really needs to be done is that, one, there has to be an informed public capable of recognizing emergencies. So there's a need for healthcare professionals to educate community members and lay rescuers like teachers, police officers, to know and assess, when there's a medical emergency. Because sometimes the difference between either a fracture or a person having like an open fracture that leads to hypovolemic shock is the difference of whether I need to request for a basic life support ambulance or an advanced life support ambulance. One has medication, one doesn't. One might be integral to stabilizing this person pre-hospital, and one may just be as good as a transportation vehicle. And by the time the person arrives to the ED, they might not have good outcomes. And so, again, there's a need for the public to know what's going on. One of the common things I love to teach about is stroke. And stroke, we call the FAST mnemonic. S is for facial slurred, A is for arm drift, S is for slurred speech, T is time, get to the hospital. And so that's something that we were able to teach them in the Dominican Republic. Secondly, there needs to be a universal access number, needs to be ambulances, and needs to have an ED with communication. Next slide, please. Thank you. So this is a team that we kind of assembled. So for myself, coming out of the Dominican Republic, we work with the U.S. Embassy and the Ministry of Health, and they also provided us some members too. But for my personal team, that being the Superhero Training Center, I was the program director, and pictured on the bottom with the polos, they were some of my lead instructors. This was an all Spanish-speaking team, and for myself, my Spanish didn't really go beyond high school AP Spanish, but luckily my instructors were completely bilingual. I was very fortunate to be given a large team with different varying experiences, from respiratory therapy to paramedic to nursing. And so pictured on the bottom are my instructors. On the top left, you see the folks in the polos and the white. They are the EMTs from the Ministry of Health and they only represent a small fraction of the EMS system in the Republic, in the capital. And so there's actually different EMS agencies, but they're one of the agencies that we work with. And then in the top right was our guide, Dr. Pacheco, and later I'll talk about stakeholders, but it's so important to find folks on the ground that believe in your mission, that have resources that can work with you in making sure that your project gets off the ground and is completed. Next slide, please. So the objectives for everyone here is when we were contracted by the U.S. Embassy, we were kind of given some guidelines and what they expected, and we kind of had to, kind of play ball with them and say, all right, so this is what you want us to do. And basically, we wanted to institute a universal training program. So imagine you have doctors, nurses, first responders, firefighters, EMTs, they're all trained in their own way. They're trained in their own system, and then now we're trying to give them additional training so that they can all be on the same page when it comes to emergency medical services. And that goes from spinal mobilization to rapid trauma assessment to medication administration to neurological cardiovascular emergencies, basically a universal way on how to treat, how to respond, how to communicate this to other people. And so we implemented this program, and we were first to train a group of physicians, nurses, first responders, and we had about 60 to 80 of those individuals, and we had a lot of people added last minute. I'll talk later about the difficulties of working with sometimes stakeholders when they kind of give you a lot of expectations and then they change them up at the end. But we basically certified about 60 to 80 people in the first couple of weeks, and these individuals went through a rigorous U.S. EMT standard program, and they were trained all the same level. Even though they had different backgrounds, they all had the same type of training, same type of skills practice, and at the end, we certified them as U.S. first responders. And then later on, we would have to not only train police officers, about 100 of them, but we also needed to make sure we trained educators. We needed to train the students to be educators so that they can take our work and disseminate it across other different type of cities and other type of providers as well. Next slide, please. So this is kind of some pictures for folks, but this is an example of training them in one of our modules, which was trauma and spinal mobilization. So we had a lot of great resources and equipment. We had backboards, we had gurneys, we had the Ministry of Health giving us ambulances. So again, it's very important to make sure you're working with the right people, the right stakeholders, to make sure that they have the resources you need. Literally, we were given an assignment, and we just had to make it happen. So you kind of have to just problem pose with your team. You have to really just map out a chart and just figure out what do you need, who can give it to you, and how can we get to them, and what do they need from us in order for them to give us what we need. Next slide, please. Here's another picture of when we went through our CPR First Aid module, which we partnered with other organizations to do this on the ground. But here we have high value equipment with feedback and getting folks to understand, hey, this is how deep you got to compress. This is what ventilations look like. This is what intubation looks like. And so you have all here the students on the ground, and we were working at the university. It's called the Universidad Autónoma, and that was the University of Health Sciences in Santo Domingo. Next slide, please. All right, so I'll kind of expedite through this, but for our methods, basically, imagine we were there for about a month, and the first 3 weeks is really just, the first week is just kind of getting your feet wet, getting used to the city, gathering all the equipment, and then the next 3 weeks were really just implementation. And so for us, first we needed to train about 60 to 80 healthcare professionals in U.S. standards. So we had our team of directors, coordinators, and I brought along 3 instructors, not including myself and my coordinator, and we were also given 2 instructors from the U.S. Embassy to partner with us. And so we kind of had a collaboration between organizations to make this happen, although we were ultimately the project lead. And we translated all these materials in Spanish. It was difficult, but we made it happen. And we also administered a pre-test and post-test, which proved to be very effective. And later I'll talk about the outcomes of how much basically the scores increased. And we were basically there almost every day, and we were there definitely overtime. It was like a 12-hour day, and we were doing didactic in the beginning, and then we did skills towards the end. So we always had instruction, and then we followed up with skills that were applicable to that lecture later on. If I gave a lecture on cardiovascular emergencies, and that means that in the afternoon, we would make sure that we went over cardiac meds, cardiac assessment, and other type of protocols as well. Next slide, please. So here's a picture for everyone. These are all of our first-generation first responders. So this is our first cohort of students. These are all doctors, nurses, firefighters, EMTs, every person that has patient care. They were all nominated by their respective departments. So it was a great collaboration from the actual country themselves. They chose the best people they could think of to attend this class. It was a huge honor. And so all these people here, and then you have some politicians in the front. And it was just really, I had a lot of fun. It was very stressful, probably one of the most stressful things I've ever done in my life. But it was a great experience, and it really tested my abilities as an MPH candidate. Next slide, please. So just other examples of folks doing tube rescuer infant basic life support CPR. Next slide. So to kind of, again, wrap this up for continuing methods, so that was our, first 2 weeks, and then our next week we had to train the police officers. So again, you're kind of understanding here that you not only train the healthcare professionals, but you got to train the community responders too, because oftentimes when we call 911 here in the U.S., who arrives on scene first? Oftentimes it's police. And so if police don't know what to do or know how to stabilize or know how to at least stop bleeding, then, there's such a delay in treatment time when, paramedics arrive on scene and they're like, you know what, this guy's been bleeding out for 3 minutes, you could have just applied pressure. And just basic things like that you think is common sense. It really isn't, because it's also the culture of the country too. Police officers, they don't want to do medical. They really just, push it off to other person. But that's the problem in mentality. You have to make sure that everyone understands that they're first responders, and there's a collaboration between public health service and civil service to make sure that we take care of the community and the public. And one of the things we taught police officers is that, hey, even though you're not medical personnel, we still want to teach you CPR, we still want to teach you first aid, so you can at least recognize what's going on. And so we did this training in the police headquarters, Policía Nacional, in Santo Domingo, and it was a great session, and I'll show some pictures later. But basically, we trained all 100, and then we had like the police captain and chief come out, media come out, so it was a great experience. Next slide, please. And here you go. We have one of my instructors, Danny, is a paramedic like myself, and here we're teaching the police officers, and they're just so energetic. I still remember at the end of our last session, one person just commented, and he said that he never dreamt that he would get this type of training as a police officer, and that he feels so safe to take care of his kids, his family, and those that he responds on scene. Because when police arrive on scene, they kind of just take a step back and like, oh, this is not my type of training. I'm just gonna wait for the ambulance to arrive. But you know what? Such a delay in time, and they're just kind of just sitting there twiddling their thumbs and maybe clearing the scene, which is good. But they can be doing other type of first responsive items too. Next slide, please. And here you have just one of the cohorts of police officers, very disciplined. They all had an open heart coming into this program, and I was very honored to do this training for the police officers. Very proud people, and the Dominican people. One thing I realized that they have such a love for their country. They have a love for their people. They all don't get paid well. Even doctors get paid really, really poorly, and they do it because they feel that it's their duty to protect and to serve and to preserve life. And so, next slide, please. All right. So the last part of the methods is then we train the instructors. And so we were kind of given an impossible task by the government, and that was to do simultaneous trainings at the police headquarters and train the instructors. So I had to split my team. I could only be in one place, so I chose to be with the instructors. And my coordinator, Richard, chose to be with the police officers. So it's hard for me because as a perfectionist, you kind of want to make sure everything's done well. And this is kind of your job on the line. This is your reputation. You're representing the U.S. You want to do a good job. So for me, I had to really trust my team, and that goes into health leadership too. In the MPH course, a lot of my curriculums, a lot of the professors that I got to work with, like Dr. Anamara, we talk about health leadership, organization, working with your team, communication, and these are a lot of the great things that I learned personally through the MPH coursework. Next slide, please. So here's a picture of ambulance and triage operations. So one of the biggest things that we taught them was disaster emergency management. So, there's been a lot of tragedies that have happened in the past couple of weeks and months. And for countries like the Dominican Republic, they don't really have a standard on how to deal with MCIs, or mass casualty incidents. If there's like a huge explosion or there's a huge disaster, what do? There's just a bunch of bodies on the ground. How can I triage the people? Who is priority? Who's tagged green as walking wounded? Who's tagged yellow as delayed transport? Who's tagged red as immediate? Who's tagged black as deceased? How can I organize a system where if I'm first responder on the scene, how can I make sure that I know who to designate as people that need treatment and people that need delayed treatment, so that by the time other ambulances arrive, they can figure out, hey, I got to help these people out first. Hey, these people, I can wait for about an hour. Again, we wanted to teach them how we organize our own type of MCI incident command structure in the U.S. And so this is one of the big things that we did, and we did a mock MCI. We had all the students kind of just lay out there. They were tagged they were given cards, and they kind of had to act, like, hey, you're altered. Hey, you're missing an arm. Hey, you're in shock. Hey, you're confused. Hey, you just have a broken arm. And we had the groups kind of just split up and figure out what to do, and it was a mess. But I'm glad it was a mess because they figured out that they needed to be organized to deal with this if it happened to their country. Next slide, please. So the outcomes is that, we were able to train the healthcare professionals in U.S. first responder standards, and we were able to also train the Capitol police officers in CPR First Aid. And we were also able to train the instructors to be instructors. And so we left having, close to 200 people certified and trained, and making sure that we created a system that they can continue to replicate our program. And so we were able to debrief and basically implement a plan that within the next 5 years, hopefully our program is able to be disseminated to neighboring cities. And again, we talk about the capital. We were there in Santo Domingo, the capital, but so many other cities and so many other outskirts of the Dominican Republic that don't have this type of standard. And the capital is lucky to have their first 911 call center, but hey, we got to do that in other cities too. And the program that we did, we got to do it in other cities as well. And earlier I mentioned that we administered a pre and post test, and it was very, very effective. We saw that when students took our pre-test, which is a 100-question USC MPH exam that covered all major modules, when they took the pre-test and the post-test, their score increased about 24% across the board. I was very, very happy to see that and see that, looks like our program was effective. Our homework, the way we taught, our skills practical, they were all effective. And we knew that, if everyone went through a program like this, you would definitely see some type of increased outcome in knowledge and practical skill in how to really deal with these emergencies. Next slide, please. So here we have the graduation of the first responders. So at the end of the graduation, very big, we went into the university conference hall, and they had media come out. It was a big honor. And, we had certificates. We had the director, Dr. Polanco of the 911 call center, come out. And then we had also represented cabinet members of the Dominican government come out as well, too. And it kind of just, shook everyone's hands and took a lot of photos. But, it was a great experience. I felt the students were very honored, and I felt that for the rest of the country to see that, the government's doing something and trying to get their foot on the ground to make sure that they mobilize their system. Next slide. So we're coming towards the end here. I kind of just want to reiterate the stakeholders that I work with, but it was the U.S. Embassy, it was the government of the Dominican Republic, it was the Ministry of Public Health, which would be kind of like our U.S. Department of Health and Human Services, or at the local level at least, kind of like your county Department of Health Services. And so we also work with the University of Health Sciences, and they were already doing these type of, medical classes, but not EMS classes. So, of course, they were the perfect fit to do the classes at their center, with their classroom, with their staff, so that they can take our program and make it into their own curriculum as well. And, of course, working with the healthcare professionals, and most importantly, the Dominican people. They are huge stakeholders because, you know what? I have a kid. If I have a family down there, I don't want to have my kid walk out the door and he gets hit by a car, and you know what? No one knows how to really treat him, and he kind of just gets put into a back of a bus and just gets sent out, and then the people receiving him, they don't really know what to do either. So for the Dominican people, they were huge stakeholders in making sure that they felt safe and they felt happy in their own country knowing that they had folks to take care of it. Next slide, please. So here are the key instructors and stakeholders. So our instructors are represented there in the polos and the lanyards. On the far left, we have Dr. Pacheco, who was just a huge help, our liaison, a personal friend of mine. Then folks in the middle, you have the president of the university, you have cabinet members of the Dominican Republic, you have folks from the U.S. Embassy and from the Ministry of Health as well. Next slide, please. And here we have a press conference and media. You have all the higher upper people on the right. So you got all the important politicians and whatnot. Then you got instructors right in front of you. And again, this is a huge honor. What you didn't see on the far left is actually all of the students that sat there during the graduation. So it was really nice. Next slide, please. So, like I said, I'm not going to get too much details, but these are the type of phases that we went through. Again, for prospective MPH students, you will really learn the importance of really mapping out your program implementation, going through phases like your first phase, your needs assessment, what's going on, what do we need to do, what's the problem, right? And so I identify these problems earlier on what the Dominican Republic needs. And then once you basically figure out, hey, this is a problem, we're going to find a solution, you move on to the next phase and you find your stakeholders, you find your partners, right? You find people that you need to work with that have the resources you need to get this off the ground and make it work. You find people invested and you collaborate with them to make sure that the project is done. Next phase, we developed our training, our curriculum. We did all of this on the ground, and we did this here in the U.S. I went through a lot of webinars, conferences, making sure that we're all on the same page. Then we implement the program, which we did in about a month. And afterwards, we evaluate. You debrief and you make sure, hey, you know, what went right, what went wrong, and you figure out how can you do this better. And if we are to revisit this country later on or replicate this type of work in different countries, what do we need to do to improve from what we did prior? And you have to reevaluate your team, the structure, the cooperation, the networks, everything. Next slide, please. So the problems that I faced during this was actually complying with strict regulations. I think our stakeholders had a lot of, I would deem, impossible objectives, being in multiple places, and giving limited resources. And the problem with stakeholders sometimes, too, is that they may not understand the work that you do. Because for me, I know what we need to do to get this off the ground. But when they say, hey, cut this in half, it's literally impossible. How can you fit a standard curriculum and cut the time in half? And so we had to really play a lot of ball with them and figure out, hey, can you compromise with this? Because at some point, I also have to have, you know, integrity as the person coming out as a representative to make sure that, hey, we do a good job too. I can't really just, you know, put 50% into this. I have to make sure that I'm advocating for the education of the students as well. Limited resources, budgets, a lot of unexpected challenges. One of the biggest challenges was that we ordered 8 spinal backboards to be used, but when we got to the airport, LAX, they didn't let us carry it on. And even though it was considered an oversized carry-on item, like a set of golf clubs, the Dominican Republic had a specific embargo on large carry-on items. Only that country, or very few countries like the Dominican Republic. So we had to ship our backboards back, and then we had to, on the ground, work with stakeholders on the ground to make sure that we got backboards, and we were able to get it from the local ambulance agencies. So a lot of unexpected challenges. Communication team dynamics, we had a lot of difficulty working with our partners and the instructors that were given to us, but we were able to compromise and make everything happen. But it's stressful. You kind of down there, you got to make everything work, and you got to just compromise. And that's something I learned a lot in the MPH coursework, communication and making sure that expectations are set forth. Next slide, please. All right, so I think it's my last slide here, but our follow-up objective is to come back, and we're actually going to come back probably next year, and we're going to do more medical work down there, but we're also going to revisit and see how effective our program was. And we also want to see how can we extrapolate your data. The work that you do as MPH students and graduates, you know, when you do it in a different country, it can be replicated in a different country as well. And that's something that I'm working with the faculty right now and seeing how we can do this in other developing countries. And so, again, the work that you do is gold. And you got to make sure, even if it doesn't work, you can still reevaluate and fix it and make it work the next time, right? And then, of course, just internal debrief, evaluate the program, and plan for the next successful phase and mission. And I believe that's all of my slides. So, again, it was a huge honor. I was very fortunate to go on this mission with my team, and being an MPH student during that time, taking classes still and also working with the faculty members to make sure that this project worked. It was a huge success. And, again, I was one of the highlights, definitely, of my career as an MPH student at USC. Thank you.
Thank you very much, Michael, for sharing that with all of us. That was fantastic. Just a quick reminder, if you have questions for Michael, please type your questions into the Q&A, and we'll definitely get those answers to you. Now, Michael, I'd like to ask you just a few short questions about your experience as a student in the USC MPH online program. What was your opinion about online learning prior to you applying to the program, and how has your opinion changed since starting the program?
Yes, Phil. So definitely I had a lot of, thoughts going through my head when I was applying for the MPH program online. But for me, being an undergrad in LA, I had a few online courses, and so I kind of had different opinions with them. I felt like I needed to be in class. I wanted to talk to my professors, and so of course, like most students, I had a little bit amount of skepticism. But then I realized that this is an online program for USC, prestigious university, one of the largest, health-oriented academic teaching universities. And I realized that, if they're going to make an online program, it's going to be really good. And so when I attended a webinar, no different from this webinar, I was able to see really the type of enthusiasm from the staff and the professors. And I read a lot of testimonials, and it was really great. And so, of course, going into the program, I had, my own mild skepticism. And then after the program, my opinion has been overwhelmingly positive. Because for me, even though it's an online program, we consider these programs because, we're busy in our own personal lives, our families, and our coursework. But you know what? I was able to still run my operations, run my training center, work, on an ambulance, do 24-hour shifts, and still accompany the coursework that I was doing as a full-time student. And most importantly, being an MPH online student really has been no different from me being a physical student on the ground, because I had the same level of interaction with faculty. Every time I request office hours, they're talking to us on the webinars, on the live sessions. I feel like they're talking to me. In fact, I consider it even more intimate. And with the professors, I get the same level of interaction as I would as an undergrad, when I can work with them, when I can do research with them, when I can project with them, when I can cooperate with them. And that, to me, is one of the best experiences as an MPH online student. So my opinion has been overwhelmingly positive after, and before it was still positive, but really it's really great right now.
Thank you, Michael. Now I do have another question regarding networking and faculty. How have you been able to engage with your peers and classmates since joining the program? I mean, what is your experience with the faculty? What stands out the most?
Awesome. So for networking, definitely networking has been strong, because one of the great things about the MPH coursework is that, yes, even though the work is online, you're in these live sessions and you have to work in as a group. And, it's not just like a group assignment where you kind of just like, oh, hey, you do this, I'll do this, and we'll just upload it. No, we're actually meeting, doing live sessions. I actually met up with my physical group for all the SoCal people in one of my earlier classes, and that was awesome. And so I was able to not only collaborate with them, but everyone comes from different walks of life. I'm working with healthcare professionals. I'm working with other public administration folks, and the networking has been great. In fact, to this day, I've been lucky to really get a lot of great friendships from my MPH coursework too, and I hope to work with them in the future, because you're really working with people around the nation, even within your own state, even within your own county, and you never know when you graduate as an MPH student, like, how are you going to cooperate with these? How are you going to collaborate with these people in the future? How can you work together with them? And you might see each other on the same side of the fence when you're doing a separate project together, or both of you join a project together. And so the networking has been awesome. And then as far as faculty, again, what I iterated before, has been just phenomenal. For myself being an undergrad, I was so involved on campus, and I really believe in the collegiate experience, which is, developing a relationship with your professors, because, they're your friends, they're your mentors, they're your colleagues. And at USC, I was able to do the exact same. So many great professors I had in the past that were very understanding, compassionate, and a lot of professors to me, stood out. Dr. Cousineau, Dr. Anamar, Dr. Burke, they're all very helpful to me, all great professors that I really enjoyed just talking with, emailing with, and they're always available. And that's one of the great things about the MPH program, too, at USC. The professors are available. They want to be there for you, and even though it's impossible sometimes, they'll make time for you. And so for myself, even working with Dr. Kumar with Director of Research has been a great honor, has been a great ambition, working with a faculty member like her, and really, kind of aligning our global health interests together and collaborating on future projects. And so there's so many other different professors too, epidemiology, biostats, and different fields. And for all the MPH, students, everyone has a different interest. And to know that there are professors there that are as interested as you can work with these people. And I'm really glad that USC has an open door policy like that to collaborate and work with faculty. But again, it's whatever you put in, whatever you get out of.
Thank you, Michael. Now, as far as time commitment, how many hours a week are you dedicating to your studies? Is your investment in the program worth it?
Yes. Like I said, most of the MPH prospective students, we're full-time. We got our own things going on. But for myself, it really kind of depends on the classes. But on the average, with 2 classes being considered a full-time student, you have live sessions where about, an hour long. And, maybe 2 hours a week to be physically sitting down somewhere, right? But, I mean, with the curriculum and the coursework, it's really kind of, at a pace that's good for you. You can study early as long as you reach your deadlines. You can space it out. But for me, let's just say I was studying or keeping up with my books maybe 2 hours a day, and I put in maybe, 10 to 20 hours a week. Maybe on a hard week where you got projects and midterms and finals, yeah, you're going to bump it up, maybe more than 20 hours. But for me, I was always able to at least, if I dedicate about, 1 to 2 hours a day, a couple more hours on the weekend, I was able to always maintain a high grade point average and relatively succeed. So, again, there are some classes that, just are difficult. For me personally, it's been a while since I took, stats in undergrad and, going through things like SPSS, epidemiology, a lot of novel things, too. It's kind of like it goes over the top of your head. But, those require a little more extra studying. And for those people that are interested in biostats and epi, they'll have a good background already, so that'll be easy for you. But for me, some classes you kind of had to space out. But you know what? You always had enough resources to make sure you got that A.
Thank you again, Michael. We will now try to answer.
Sorry, Phil, to answer your question, was the investment worth it? Yes, it was definitely worth every single ounce of effort. I am very happy as an almost graduating student, and I highly recommend the program to other prospective students as well.
Thank you. Now, we will try to answer your questions. To submit a question, please type it into the Q&A box, along with myself. Enrollment Advisor Stephen Gutierrez is available to assist you with your questions today. If we don't get to your question today, one of us will follow up with you directly. In the meantime, the admissions requirements and application deadlines are listed on the following screen. Please reach out to an enrollment advisor with questions about the application process. You will see contact information listed on the next slide or two. Now, our first question is, are there any career placement services available to students? Dr. Kumar, could you answer that?
Sure. Yes, there are career placement services available. USC has a career center which works with all of the undergrad and graduate students to help them identify opportunities, work on resumes, practice interviewing skills, etc. So we have excellent career center resources, as well as MPH-specific resources as far as opportunities for jobs and internships.
Thank you, Dr. Kumar. Our next question is, how is the online program different from the campus program? Dr. Kumar, would you answer that again, please?
Sure. So both programs have the same admissions requirements, same degree requirements. You get the same degree when you graduate. We have a similar curriculum in that online we offer 4 tracks. On campus they do offer additional tracks of study and electives. But online we offer the track in global health leadership, health education and promotion, biostatistics and epidemiology, as well as a new track in geohealth, which is about spatial analysis applied to public health, which is actually exclusively offered online only. But same faculty teaching the courses, really same program. It's just a matter of one's online, one's on campus.
Thank you, Dr. Kumar. Now, is it the same diploma?
Yes, it is. Absolutely.
Thank you. Now we have a question here. Now either Michael or Dr. Kumar, if you wanted to chime in, what will be some of the online barriers with me? I live in Rochester, New York, which is a 3-hour time difference. Will this be an issue?
Yeah, so we have several students who are on the East Coast as well as internationally, and they have been able to succeed in the program. The only really time issue is when you have to attend the live sessions. For that reason, we hold them in the evening times. So typically between 5 to 7 p.m. Pacific is when faculty will hold their live sessions during a weekday. So for our East Coast, that means between 8 to 9 p.m. So we do try to accommodate students living in various time zones because that is the majority of our population. Other than that, you have equally the same access. So it's just the live sessions. You're going to want to be available in the late evenings to participate.
Thank you, Dr. Kumar. Now, our next question is, how many courses are required per semester? Stephen, could you answer that for us?
Sure. With requirement of courses, a full-time student would be taking 2 classes in a given semester, typically spring, summer, and fall. This is what would put them at the pace of earning their degree in 2 years. But in a given semester, a student may choose to take 1 class. As being a part-time student, this is something you'd want to discuss with your student advisor as you progress through the program or in any given semester.
Thank you, Stephen. Our next question is financial aid available? Stephen, could you answer that for us, please?
Financial aid is available to those who qualify. You would be starting by filling out the FAFSA, the free application for federal student aid, as with most of our students as to what they do. This is the starting point, and then as you progress through the process, of course, you're going to be working directly with the financial aid department here.
Thank you, Stephen. That is all the time we have. Thank you very much to Dr. Kumar and Michael Pham, and thanks to everyone who participated today. If you have any questions or think it's time to apply, please reach out to either myself or Stephen Gutierrez. Our contact information is on your screen now. A copy of this recording and slide presentation will be available in the following weeks. This concludes today's webinar. Thank you again, and have a great day.